Metabolic disorders. These are the areas, if you understand, you should not miss an answer. Metabolic disorder, one of the most important things that you should remember, they behave in different ages. Child will have more ALP, will have more phosphate levels. Wrist is rickets, knee is scurvy. That was the classical teaching. If they show you wrist, it's still rickets, but knee, now they can show you for rickets or scurvy, anything now. So what is the differentiating point? I'll explain. If you look at the end of a bone, and because of the pressures, it assumes the shape of a cup. It's placed down, means becomes wide, and the ends of a bone, they point outside. This is called as cupping, splaying, and flaring. This is classically seen in rickets, and splaying, which means widening, is the most specific. So widening is rickets. Whereas if you look towards the end of a bone, there is a white line towards the metaphysis called as white line of Frankel. Plus, if this is the epiphysis, its boundaries are again whitish, called as Wimberger ring sign. Sclerotic margin of epiphysis, the most specific for scurvy. So, widening is rickets, whitening is scurvy. Rickets is a mineralization defect. It can be because of vitamin D deficiency, calcium deficiency, phosphate disorder, and it occurs in a growing skeleton. In rickets, there is a generalized muscle weakness, widening around the joints, prominent costochondral junction called as rachitic rosary. In rickets, this rosary is round and non-tender. Harrison's groove is a groove because of the pull of the diaphragm. Just beneath the rib cage, there is a sulcus. Subcostal sulcus is the pull of diaphragm. Bones are weak, the muscles are weak, bones are weaker than the muscles. So there is drawing of the bones inside. Genu valgum or varum. Valgum in an adult RA, varum in an adult OA usually. But in rickets, in a child, valgum and varum either can occur. There is coxa vara, reduced neck shaft angle of femur. There is defect in the enamel of the tooth. The enamel defect is rickets. The dentine defect is in scurvy or osteogenesis imperfecta. Cupping, splaying, flaring, I told you. And in rickets, an osteotomy correction is done. Only once on X-ray you see healing. So you can remember like this: abdomen protuberant because of the muscle weakness, bowing of the bones, costochondral junction prominent, rachitic rosary, craniotapes, there is delayed fusion of the sutures of the skull, ping pong skull. That's the earliest feature of rickets. Diaphragmatic pull causing Harrison's groove. Enamel defect E. Forward sternum or pigeon chest. Growth plate widening. So these are the points which you will classically see in rickets. Genu valgum and varum. When you look at the rickets, this is the rachitic rosary that we spoke about. This is the genu valgum or genu varum. Cupping, splaying, flaring. You treat it with calcium vitamin D and you will see a white line of Frankel. White line of Frankel is classical of scurvy, also seen in healing rickets. So out of B and C, C is healing because you see the white line, and the cuppings, splaying, flaring also have gone down. This looks hazy. This looks more focused. Rickets, there is widening. There is flaring. Hypophosphatemic rickets is a genetic rickets, X-linked dominant. Phosphoregulatory gene mutation. Phosphaturia occurs. Normal calcium, parathormone and vitamin D, high ALP. They have more skeletal abnormalities. Phosphate losing rickets. Osteomalacia, adult counterpart of rickets. Osteoid, or the immature bone is more than the mature bone. How do you prove it? Biopsy. In previous time, they were giving tetracycline labeling to figure it out. Also, when there is a bone softening, it's more common in females. Triradiate pelvis, the pelvic inlet appears like a triangular shape. There is coxa vara. The acetabulum is pushed inside because it's soft. When it's bilaterally pushed, it's called as orthopelvis. That's how it looks like. Protrusion of the acetabulum both sides, triradiate pelvis, coxa vara, hollow bone. Wimberger ring sign is sclerotic margin of epiphysis seen in scurvy. Wimberger corner sign is a defect in the metaphyseal area seen in congenital syphilis. So scurvy, white line of Frankel, which is seen in healing rickets, lead poisoning and methotrexate therapy, but is classical of scurvy. That's how the white line of Frankel looks like. This is the sclerotic margin of epiphysis, called as the Wimberger ring sign. This is rickets, widening. There's no whitening. This is scurvy, widening, all white. So scurvy, whitening. Rickets, widening. If you remember this white and white, you will be through. Bone softening disorders like osteomalacia, hyperparathyroidism, neurofibromatosis or rickets, but less common than osteomalacia. The bones are weak. The arterial pulsation will do indentation on the soft bones. They are called as pseudo-fractures. They are not fractures, just indentation of the cortex. Milkman fracture or loser zone. They are classically seen around the neck of femur or the pubic rami. Treatment is rest and treat the primary cause. That's how they appear. Alright, so that's how they appear. This is indentation on the cortex, called as milkman fracture, very common in milkman because they themselves don't take milk and suffer from calcium vitamin D deficiency. One more thing that you must remember, the lower end of femur is sometimes given appear of a celery stalk. This is called as a celery stalk appearance, seen in congenital rubella, also seen in chronic degeneration of the anterior cruciate ligament.